Health and Social Care Quality Improvement Network, known as HSCQI, has been gathering learning from COVID-19 over recent months to ensure that we can share and spread best practice, improvement and innovation. We have seen amazing improvements in the way we deliver care and in the ways we work, all of which are helping us to collectively meet the challenges of COVID-19. HSCQI project teams focused on virtual visiting, virtual consultations and staff psychological wellbeing are underway and progressing some very exciting work. This work has the potential to connect families and loved ones, healthcare professionals and patients and service users, and to make a real difference to the well-being of our citizens and our staff. This work is about people, compassion and connections. Please take a few minutes to find out more.
Our Southern Trust virtual visiting project started back in March, driven by a desire to provide the benefits of face-to-face visiting for our patients and their loved ones during COVID virtually, using tablet devices. We developed the service with the help of an amazing group of medical and dental students who connected over 1,300 calls. For our patients and visitors, video calling has almost always been a new and very welcome experience. We connected a husband and wife who hadn't seen each other in 4 months, linked calls to New Zealand and Australia, connected a dying patient with her children in America, and even managed to get a father to church on time, delivering a speech at his son's wedding from a hospital bed. Ironically, COVID helped us recognise this unmet need for virtual visiting, which will benefit our patients and their visitors for years to come.
We did have a number of families that, they had relatives, or the patient had relatives abroad, and obviously extremely anxious that they couldn't get home, no travelling, they couldn't get home to even be with the family that was here, let alone see their loved one who was in ICU. So using the PEXIP app to connect with families in various countries was fantastic. We were speaking to family members in different countries throughout our time in ICU, and to be able to see their relative, even the staff who were looking after them, etc., it was really comforting for them.
Care home perspectives, virtual visiting was absolutely essential through this year, the real difficult challenges we've all had. Particularly, if you can imagine, for residents that passed away, very, very difficult. The virtual visiting and the use of iPads and phones was critical for them to be able to get peace of mind how their families were being looked after, and really to give them, I suppose, their last words, what they wanted to say. We relied a lot on the goodwill of our staff to make that happen. So moving forward, it was huge learning, I think, for us. Virtual visiting is absolutely essential for all our residents, and at the end of the day, this is their home. They're not generally here for a short stay. A lot of them, this is the last home that they will have, and we want to provide and facilitate as much as we can for their well-being and their happiness each day.
Prior to COVID-19, there were examples of phone and video consultations all across Northern Ireland. Virtual consultations has the capacity to connect service users and the healthcare workers without all the hassle of having to travel to a hospital or a GP appointment. It means that we can provide the same safe care, but with no travel and very little waiting. Better yet, it means that time can be released for the service users to do what matters to them. In Northern Ireland, we have the capacity to scale, spread and standardise virtual interactions, not just for COVID-19, but to future-proof our health service for whatever challenge that may lie ahead.
The virtual clinics have been life-changing for me as a patient, and the virtual clinics have allowed me to access support, access advice and guidance regularly, frequently, without much hassle. It's made it accessible for family life and work life, and I've even attended a virtual clinic on holiday.
Psychological well-being is so important as we continue to work in a heavily pressurised health and social care system. This pandemic has highlighted that situation more than ever. We as clinicians are constantly finding severe pressure in the system, And that psychological well-being is so important to ensure the relationship that we have with each other as colleagues and with our patients is the very best it can be. Evidence has shown that poor psychological well-being can be linked to low quality patient care, safety issues, reduced empathetic abilities and workforce problems due to absenteeism. Quite often in our system where there are processes, it can feel cold and inhumane. But we must ensure that all those processes link in to the psychological well-being of each individual. In that way, we can deliver the very best of patient care.
As a family carer and advocate for improving the quality of health and social care services for families and patients, I know this work will make a real difference to lives. COVID-19 has presented us all with huge challenges, and life continues to be so difficult for so many. This includes those of us who provide care at home, families trying to keep in touch with patients and service users receiving care, and the staff who are caring for our loved ones. It is great to see that people, compassion, and connections are truly at the heart of this work.